Welcome to Paals. It's Prof Anyanwu's anatomy lecture series. In this place, our goal is to make anatomy simple. If you're just joining us, you have not subscribed, we would like you to subscribe now and be part of this amazing anatomy family where we make anatomy simple. This is a lecture on the pericardium. We'll be discussing the location, functions, components, innervation, and blood supply of the pericardium. We'll also look at the pericardial cavity, pericardial sinuses, and also we'll end with the associated clinical correlates. So let's go to class. The structure I want to look at today is actually the structure that will be covering the heart. And the heart is seen in the middle part of a septum called the mediastinum. So we will start with some few slides on the mediastinum. So this is the region that is called the mediastinum. That's the entire region where we'll be seeing some of the structures we'll be looking at in today's lecture. So what is this mediastinum? It is a mobile partition that is formed by the structures occupying the central part of the thoracic cavity, and this area will be seen surrounded by the lungs, the two lungs, one on the right and then one on the left. So this mediastinum, in this view, we'll be seeing the entire structure, thoracic cavity, from the lateral view. So this mediastinum will be seen separated into two parts. The part from this point above will be the point we'll be referring to as the superior mediastinum, and the area below is the area we'll be calling the inferior mediastinum. So this inferior mediastinum will be divided into three parts. We're having the anterior part here, we'll be having the middle part here, and be having the posterior part here. So here is the anterior mediastinum, and here is the middle mediastinum, and then finally here is the posterior mediastinum. So we're coming back to where we started, which is the middle mediastinum, and that is the region that we'll be having at the center of the inferior mediastinum. So the contents of the middle mediastinum are as follows. We'll be looking at the heart and the structures that are surrounding the heart. Of course, that is the lining of the heart, which is the main focus for today's lecture, and that is the pericardium. In addition to that, we'll be seeing some other structures like the ascending aorta at this point. We'll be seeing the pulmonary trunk. We'll be looking at the superior vena cava. We're going to move straight into the focus for today's lecture, and that is the pericardium. And this is the pericardium surrounding the heart. So the first question is, what is this pericardium? We'll start with the root words forming it. From the word peri, which means around, and then cardio, which refers to heart. So it simply means the structure that is surrounding the heart. So by definition, we can say it is a double-walled fluid-filled sac. It contains the heart and root parts of the great vessels. That's the structure we are looking at here. That's the pericardium, the structure that is seen surrounding the heart alongside some of the great vessels of the heart, as you can see from this illustration here. The next focus is functions of the pericardium. The pericardium does a lot to the heart. Number one, it keeps the heart contained in the thoracic cavity. By this, we'll see it working as a cardiac seat belt. Number two, it prevents overexpansion of the heart when the blood volume increases. Number three, it limits the heart movement. And finally, it acts as a shock absorber with the help of the fluid-filled sac. So as we said earlier, the pericardium is a double-layered serous sac. That means it has part of its components that is fibrous and another part that is serous. So it encloses the heart and also the roots of the great vessels of the heart. Where do we find the pericardium? We can see it lying posterior to the body of the sternum and the second to the sixth costal cartilages. So in this picture, we can see the location of the pericardium. Here we are seeing it's lying deep to the sternum and also the costal cartilages, which we said is the second to the sixth. And we also will be seeing it lying anterior to the vertebral bodies, and in this case thoracic bodies, between T5 and T8 vertebra. We'll look at the components of the pericardium. The pericardium has two components. It has an outer component and an inner component. The outer component is a single layered fibrous sac, which we'll be calling fibrous pericardium, and then the second component is the inner double layered serous sac, which we'll be calling the serous pericardium. So the pericardium can be divided into the fibrous pericardium and the serous pericardium. So in this illustration, we can see the pericardium and its two major components, the outer fibrous layer called the fibrous pericardium and the inner serous layer, which is called the serous pericardium. Now we'll be seeing the inner serous layer dividing further into two parts. We'll be looking at the inner visceral layer and the outer parietal layer, while the outer fibrous layer will remain as a single layer. We'll be taking more information on these layers as the lecture continues. Now we'll look at the outer fibrous layer. It is composed of tough fibrous tissues, where we say that the inner layer is transparent and has two layers, and these layers, the outer one will be called the parietal layer and the inner one will be called the visceral layer. So we have the outer parietal layer and the inner visceral layer. In this illustration, we can see the fibrous layer as my light runs across it, and then we'll be seeing the two inner double-layered serous membrane. So these are two double-layered membrane. Now the two layer in the outer part, we're seeing the outer part that is called the parietal layer of serous pericardium, and here we're seeing the visceral layer of the serous pericardium. We'll start with the fibrous pericardium. For the fibrous pericardium, it's a tough conical outer fibrous sac which protects the heart against sudden overfilling. So here, this is the outline of the fibrous pericardium as it's seen covering the heart. As we noted, it is tough, and then it's a major part that protects the heart from this sudden overfilling. We'll look at the extensions. Now superiorly, we can see this layer being pierced by some of the great vessels, beginning from the aorta. So this is part of the ascending aorta. The next one we'll look at is the pulmonary trunk, and at this point we'll be seeing the pulmonary trunk. That's the part of the pulmonary trunk here, and then we'll also see the superior vena cava, and then here is the superior vena cava. Now this fibrous pericardium will fuse with the tunica adventitia of these vessels, or the outer lining of these vessels. When we follow the fibrous pericardium distally, we'll be looking at the fusion of the pericardium with the central tendon of the diaphragm, and this is where that fusion is taking place. Here we'll consider the other extensions of the pericardium. Anteriorly, we'll be seeing the structure that is relating to it anteriorly. That's the structure here. So we'll be seeing it attaching to the posterior surface of the sternum, and this attachment is by a condensation of connective tissue that is called the sternopericardial ligament. So here we see the fibrous pericardium getting attached to the posterior aspect of the sternum or the inner aspect of the sternum via this ligament called sternopericardial ligament. Now when we move posteriorly, we'll be seeing this structure being pierced by pulmonary veins and inferior vena cava. So here the heart has been removed, but part of the fibrous pericardium, they are still here, and we're seeing those posterior relations. These are the four pulmonary veins, and then this is also the cut part of the inferior vena cava. So this fibrous pericardium will also become fused with the tunica adventitia of these vessels that we noted as seen in its posterior relation. Now the serous pericardium. As we noted earlier, it is a thin serous membrane, and then it has mesothelial lining. We had earlier said it is double layered, and we noted that the two layers are the outer parietal layer, which is the outer layer, and then the inner visceral layer. Now, the outer parietal layer will line the fibrous pericardium and will become continuous with the several layers around the roots of the great vessels, while the inner visceral layer will be reflected on the heart and will form the external layer of the heart wall, which is called the epicardium. Now, these two layers are continuous with each other at the base of the large vessels. So here again we'll be seeing the parietal layer of the serous pericardium, and then here we'll be seeing the visceral layer of the serous pericardium, and then at the region of the great vessels we'll see a continuation of the parietal layer with the visceral layer. There are some few differences and similarities between the parietal pericardium and the visceral pericardium. Now, the parietal pericardium is seen being adherent to the fibrous pericardium, while the visceral pericardium will be seen adherent to the myocardium of the heart. The parietal pericardium also develops from the somatopleuric mesoderm, while the visceral pericardium will be seen developing from the splanchnopluric mesoderm. The parietal pericardium will be innervated by somatic nerve, and soon be telling you it is actually the phrenic nerve, while the visceral pericardium will be innervated by the autonomic nerve fibers. The parietal pericardium will be sensitive to pain, while the visceral pericardium will be insensitive to pain. And now we have seen the two layers of the serous pericardium. We'll be considering the space between these two layers, and the space between these two layers is called the pericardial cavity. So what is the pericardial cavity? It is the very thin space between the two serosal layers, the visceral and the parietal pericardium. It actually contains a very thin film of serous fluid, and this is called the pericardial fluid. And what it does is to help to give a frictionless movement of the heart. The volume of this fluid will be about 50 mL. So here I'm running my light within the pericardial cavity. If you remember that the inner lining is this, which is the visceral layer, and then the outer lining is this, which is the parietal layer. We'll look at the contents of the pericardium. As we noted earlier in the lecture, we saw the heart, which is the major content, and then the rest here are those structures that are emanating from the heart. And what are those structures? We talked about here is the pericardium, and then here is the pulmonary trunk, here is the ascending aorta, and here is the superior vena cava. And then by the time we come towards this lower part, we'll be seeing a section of the inferior vena cava. And then at the posterior aspect too, we'll be seeing the four pulmonary veins as they pierce to enter the heart through the pericardium. The next structure we'll consider will be the pericardial sinus. So these are spaces or recesses that be seen between the parietal and visceral layers of the pericardium. And these spaces come as a result of reflections of the visceral pericardium around the great vessels. Now, this will be seen developing during the folding of the embryonic heart. And we have two main sinuses. The first one is the oblique sinus, and the second one is the transverse sinus. We're going to start with the transverse sinus. Now, the transverse sinus is the space that lies posterior to the ascending aorta and pulmonary trunk, but anterior to the superior vena cava. Here is the region of the transverse sinus. So this space lies posterior to the pulmonary trunk here and ascending aorta here, but anterior to the superior vena cava. So this is an examiner's finger within the transverse sinus. And then if you can also look at this picture here, we see the finger of this examiner running through the transverse sinus. The oblique sinus is an inverted U-shaped blind recess. It lies posterior to the heart, extending posterior to the left atrium, and can be entered inferiorly. So this is an examiner's hand passing the three fingers into the oblique sinus, and this entrance is via the inferior part of the heart. Now this is produced by the reflection of the pericardium onto the pulmonary veins and inferior vena cava, which are the posterior relations of the pericardium. The blood supply to the pericardium can be divided into two parts: blood supply to the fibrous pericardium and parietal layer, and blood supply to visceral layer of the serous pericardium, which is called the epicardium. For the fibrous pericardium and parietal pericardium, we'll be talking about the pericardiophrenik artery, the musculophrenic artery, and these are all branches of the internal thoracic artery. We also have the pericardial branches of the bronchial, esophageal, and superior phrenic arteries. Now the blood supply to the visceral layer of the serous pericardium, that's the epicardium, is from branches of the coronary arteries. Now for the venous drainage, the drainage is via the tributaries of a zygous system of veins. We also see the pericardophrenic vein, which also drains into the internal thoracic vein. The nerve supply is actually two as well. The nerve supply to the parietal layer of the serous pericardium and also the fibrous pericardium. So the nerve supply to these two layers is the phrenic nerve, while the nerve supply to the visceral layer of the serous pericardium is by the sympathetic and parasympathetic fibers, and this will be through the sympathetic trunk and the vagus nerve respectively. Now the next area of interest is some few clinical correlates, and we'll start with pericardial effusion. So first, what is pericardial effusion? It is the accumulation of excess fluid in the pericardial space. Now the heart we are seeing here has fluid filling its pericardial cavity. When this obstructs the beating of the heart, it is termed cardiac tamponade. So this is a case of cardiac tamponade. Now it goes with this number of symptoms, and they are severe edema, low blood pressure, shortness of breath, dizziness, chest pain, cough, and rapid pulse. Now the causes could range from inflammation, rheumatoid arthritis, previous surgeries, cancer, infection, kidney failure, hemorrhage, trauma, or sometimes the cause can be idiopathic. Now this picture here shows us a normal heart, and then here shows a heart that is having a buildup of fluid within the pericardium and leading to pericardial effusion. Tamponade is treated by draining the fluid from the pericardial sac, and this is usually via a tiny catheter that will help remove the fluid and relieve the pressure on the heart, and also restore normal cardiac functions almost immediately. So in this heart, we are seeing a case of pericardial effusion, and then even in this radiograph, we can also see a case of pericardial effusion. Another area of interest in the heart is pericarditis, and which is inflammation of the pericardium. Now there are a number of infections that can lead to this, and they will range from viral infections, bacterial infections, tuberculosis, fungal infections, and patients with AIDS have been known to frequently develop infections that commonly produce pericarditis. Other causes include autoimmune disorders. Autoimmune disorders that can cause pericarditis include rheumatoid arthritis, lupus, and then scleroderma. We've noted pericarditis to occur in up to 15% of the patients who have acute myocardial infarction, that's heart attack. So this is a case of pericarditis. We have this procedure called pericardiocentesis. It's actually a procedure done to remove fluid that has built up in the pericardium. How is this done? It's done by using a wide bore needle inserted through the left fifth and sixth intercostal space near the sternum. This is the area of cardiac notch. And then in this illustration, we can see the procedure. Now, intracardiac injections can also be given through this area. This is where we end this lecture. If you have questions, comments, suggestions, please drop them in the comment section. If you consider this material helpful, we will encourage you to subscribe, like our video, share it to your friends that will also be helpful too. And together, we will build a unique anatomy family where we make anatomy simple. See you in my next video, and bye for now.